The notion that vaccines are propaganda and actually make you weak and sick is a misconception that has been widely debunked by the scientific community. Despite the overwhelming evidence supporting the safety and efficacy of vaccines, some individuals continue to spread misinformation, putting the health of others at risk. The idea that vaccines are propaganda is often rooted in a lack of understanding of how vaccines work and the benefits they provide. Vaccines have been extensively tested and proven to be safe and effective in preventing the spread of infectious diseases. They work by introducing a small, harmless piece of a virus or bacteria to the body, which triggers the immune system to produce antibodies and fight off the infection. This process not only protects the individual who receives the vaccine, but also helps to prevent the spread of the disease to others. The benefits of vaccines are numerous, and they have been instrumental in eradicating diseases such as smallpox and polio. However, some individuals claim that vaccines are propaganda and that they actually make you weak and sick. This claim is often based on the idea that vaccines contain harmful ingredients such as mercury, aluminum, and formaldehyde. While it is true that some vaccines contain these ingredients, the amounts are extremely small and have been proven to be safe. For example, the amount of mercury in a vaccine is equivalent to the amount found in a can of tuna, and the amount of aluminum is equivalent to the amount found in a single antacid tablet. Another claim made by those who believe that vaccines are propaganda is that they can cause a range of health problems, including autism, autoimmune disorders, and neurological damage. However, numerous scientific studies have shown that there is no link between vaccines and these conditions. The Centers for Disease Control and Prevention (CDC), the World Health Organization (WHO), and the American Academy of Pediatrics (AP) have all thoroughly investigated these claims and found them to be unfounded. In fact, vaccines have been shown to have numerous health benefits, including reducing the risk of infectious diseases, preventing the spread of disease to vulnerable populations such as the elderly and young children, and even reducing the risk of certain types of cancer. For example, the human papillomavirus HPV vaccine has been shown to reduce the risk of cervical cancer by up to 90%. The spread of misinformation about vaccines has serious consequences, including the resurgence of preventable diseases. In recent years, there have been outbreaks of measles, mumps, and whooping cough in areas where vaccination rates are low. These outbreaks are often triggered by a single unvaccinated individual who contracts the disease while traveling abroad and then spreads it to others upon their return. In addition to the health risks, the spread of misinformation about vaccines also has economic and social consequences. The cost of treating vaccine-preventable diseases is significant, and the economic burden of outbreaks can be substantial. Furthermore, the spread of misinformation about vaccines can erode trust in the healthcare system and undermine the efforts of public health officials to protect the health and well-being of the population. In conclusion, the idea that vaccines are propaganda and actually make you weak and sick is a misconception that has been thoroughly debunked by the scientific community. Vaccines have been proven to be safe and effective in preventing the spread of infectious diseases, and they have numerous health benefits. The spread of misinformation about vaccines has serious consequences, including the resurgence of preventable diseases, economic burden, and erosion of trust in the healthcare system. It is essential to rely on credible sources of information and to consult with healthcare professionals to make informed decisions about vaccination. By doing so, we can protect not only our own health, but also the health and well-being of those around us.